Hello everyone, Dr. Jason Deitch here, and I have the pleasure of introducing to you my good friend Dr. Krista Burns. Dr. Krista, welcome, thanks for making time. I know you travel the world, not only because you are really smart and have created an amazing lifestyle for yourself and Dr. Mark Wade, but because you're really committed, like myself and many others, in really helping bring this message of chiropractic through posture in this case, to as many people around the world as you possibly can. So let me start off by saying thanks for joining us, thanks for being here, and I'm excited to learn more about this new program that you have coming out.
Well, thanks so much, and you know what, pleasure's all mine. Even when I'm traveling, I always want to make time to share more information about posture, about chiropractic, and in this case, postural neurology, which we're going to be diving into today. So thanks for having me, I appreciate it, it's always great to connect.
Thank you. Let me start off with those who may not know about you. You know, we have enthusiastically promoted your programs in the past. You have a brand new program that we'll go into some detail about, but for those who've really never heard about you, don't know who you are, what you've been doing, you've created the American Posture Institute, and maybe let's start with, you know, sharing some people who are new to the conversation. What is the American Posture Institute?
Yeah, thanks for that. Well, the American Posture Institute, as you said, it's all about posture. So we're educating healthcare professionals worldwide. We have students in over 33 countries, and we, through the Certified Posture Expert program, have taught them how to position themselves as a posture expert within their community. Jason, you and I both know the importance of communication, and posture is such a great way to communicate what we do in the chiropractic profession. Yeah. Just by hearing the word posture, what did you just do? You sat up straight, right?
Exactly.
And that's exactly why posture is such a good way to communicate what we do to the general population, because they get it. They understand. It's a word they've heard since they were little kids about sitting up straight. And, you know, mom didn't understand all the physiology behind proper posture, but she knew it was important to good health and well-being. So by focusing on posture and having a posture-related message when communicating with the general population, it just makes it so easy for them to understand what we do. Yeah. So we've had the Certified Posture Expert program, and all of our trainings are completely online through the American Posture Institute. We've had great success, and it's so amazing. It's fulfilling to watch the doctors implement this information into their clinics and how it's helping them grow. And we've just come up with a new course as well called Postural Neurology, which we'll talk about today. So that's the American Posture Institute, and it's so fun to connect and share the message.
It's been awesome. I know the people that have signed up for your current program have had wonderful success. I love the idea, which is why I'm very enthusiastic. We don't promote just anybody or anything, but you know, we both know, besides, you know, having good times together when we bump into each other on the road somewhere, the idea, the concept, and we've been creating a lot of social media memes together, but the idea of using posture as a conversation starter and as a window. I don't know anybody who goes, I don't believe in posture, I'm not interested in posture, I'll ask my doctor about all the garbage people respond with. You do have a new program coming out. It's Postural Neurology. I'm very involved with that as well through Life University and Guy Reekman and functional neurology and so on. You see a lot of talk about brain health, the connection, and so on. We have a new program called Look Up America that we've been working with you on.
Yes.
Share with us. I mean, it's almost as if it's kind of combining two brilliant ideas that together make something even better. What's postural neurology?
Yeah, so postural neurology is the second step in the sense that we have all these certified posture experts, and we have people focusing on posture, which is excellent. Now, the Certified Postural Neurology program is to understand the neurology controlling the posture system. So understanding from a brain-based approach. We all completely understand that the brain is the master controller of the system. That's not new information, you guys get it. But what my question is are we utilizing that to our advantage, or are we kind of ignoring it because we don't fully understand it? So through this program, it's brain-based postural analyses and brain-based treatment protocols in a way to stimulate the neurology controlling the posture system. I can go into a million details. We actually have a free training just to give you guys, you know, a jump-off point of how to implement this into your practices, but understanding that posture, you know, we may look at it from a biomechanical standpoint, but there's so much more to it. The brainstem controls posture. The brain creates neuroplasticity to maintain that proper posture. So we're going to dive deep into all of those conversations in the free training and then again in the course as well.
Awesome. So I've asked to give us some access to be able to share your training. There's a lot that I know people will get by watching even the free training. just to understand the concept better. But let me ask you, is this just a communication program, or how is this going to help doctors in their practice improve results and get better clinical outcomes in their practice?
Yeah, thanks for that clarification. It's 100% applicable. And here's the cool part, is we actually did a survey to the profession, and we got a lot of responses back. 83% of the doctors out there, they told us, I want more neurology, but the reason I haven't taken action before is because I felt like it was over my head. So with that being said, we've taken all this complex neurology. It's a complex system. We can't change that. But what we can do is take the most important concepts from that complex system and apply them to our everyday patients. So we're talking about clinical application in postural neurology. That's the most important thing. We want you guys to walk away with a ton of clinical application analyses plus treatment protocols to add to your adjustments. We're not going to teach you how to adjust. You can implement this with what you're already doing in your clinic to help your patient hold their adjustment longer outside of the office and to get better overall results by stimulating that neurologic system to make neuroplastic changes in the posture system. So it's very clinical, it's very applicable, and your patients are going to get such great results. We've already clinically tested everything. It's superb.
Doesn't matter what technique you use. This is not, you don't have to change your protocols in a significant way. These are additions that you pick and choose what to add, when to add, and so on. So this isn't, restructuring your entire practice. It's a simple thing to add in and implement. Is that right?
That's just it. And you can utilize whatever technique you're already utilizing, because we understand through postural neurology that an adjustment is a stimulation to the system. More about that, it's the strongest stimulation we can give to the body. So what you're doing with chiropractic care is already so great. Now let's add on some additional things to help them hold their adjustments longer. And another thing that to us is very valuable at the American Posture Institute is we don't want to say, listen, you need to follow step A, B, and C, and you must do it exactly like this. Right. We're going to give you all the information via an online course, and we're going to give you all the different treatment protocols. And then we're going to say, docs, you choose what works the best for the flow of your clinic. You can implement everything A to Z. You can pick and choose what you like and what works with the flow of your office. You can teach your CAs how to train your patients to do brain-based postural correction treatment protocols in office or at home. If you don't have a big rehabilitation facility, no big deal. Just, you can have your patients doing this stuff at home. So I just like to reiterate that there's a lot of different ways that you can implement postural neurology. It works with all techniques, and you can pick and choose what's going to work the best for your clinic.
I love it. I guess there's no coincidences. This is a very, I think, timely conversation. We've talked previously about our Look Up America campaign. We think we are ahead of the trend. I want to hear from you, share with our audience, because we're in complete alignment with this. Why is this such an important topic for today's modern, families, so to speak,
Yes.
different than it's ever been in generations past?
It's so brilliant. And Look Up America, Jason, I can't commend you enough for this project. It's going to put the chiropractic profession exactly where we want it to be, at the forefront of healthcare education, and position the chiropractic profession in a way that to take care of the modern day patient, because as you just mentioned, modern day patients have different needs than we've ever seen in the past. This could not be better timing for Look Up America, for postural neurology, because here's the deal. The millennials are the first generation to be born attached to a device. I mean, from the day that they're born, they're spending a minimum 8 hours per day attached to a device, their cell phone, their iPhones, their computer screens, their iPads, all of it. And even their multitasking.
Birth, it's crazy.
Yeah, it's totally crazy. And beyond what we're seeing with tech neck, so tech neck is, obviously strained to the cervical spine by looking down. In addition to that, what we're seeing is that it's no longer just a musculoskeletal issue. It's actually leading to what's called digital dementia. Digital dementia is a new diagnosis in the medical profession, which is demonstrating that children who are attached to their devices are demonstrating brain deficits similar to advanced patients with dementia. They have an inability to remember things, an inability to maintain proper posture. They're just absolutely seated in front of their devices in this flexor dominant posture. And the result is it's changing their brain function. Yeah. So what we want to do is get in there and say, let's recognize that this is the current state of healthcare and recognize that opportunity to own this with the chiropractic profession, because we can absolutely take charge and halt postural decline. We can take it head on. So Look Up America is where it's at.
Thank you.
Share that information.
It's one of the things I love, about working with, both you and Mark is that, I've been saying this for a while now. There's a new conversation to be had, educating the public about chiropractic by just simply telling them what we do as opposed to, connecting with their needs and relevant issues. I think is going to, either be the key to our success or the, I'll say continued frustration that we have as a profession. So that's why I'm so enthusiastic about this. I just think the timing couldn't be better. If we as a collective profession, if, as an individual practice and collectively where I stand, if we don't capitalize on this, epidemic, we are missing a major opportunity. This is a structural issue. It's not a pharmaceutical chemical issue. Exactly. We just have to come up to today's modern times and ourselves make some adjustments in our communication.
Yeah, no drug is going to correct tech neck.
Right.
We know that, and we recognize that opportunity. We're glad that they don't have a drug out there for tech neck, right? We're happy about that, and this is our ability as a profession to step up. And again, we can halt postural decline if we all work together by sharing the information from Look Up America. Absolutely.
I love the language you're using: flexion dominant, postural decline. Those are new buzzwords that I can't wait to watch more of the details and in fact see the program. Obviously, anybody watching is to go through the free training, learn all about, how do you implement this in your practice. But for those that haven't gone yet, go. I don't know what you're waiting for. There's a link by the video. But maybe just give a little bit more detail about some of the specifics. I know most practicing chiropractors in the back of their head are saying, I don't have the time, I'm understaffed, I don't want to do a major, renovation or buy a ton of new equipment or, dramatically change my protocols. Everything is working quite well. So share with us a little bit more insight. Do you have to buy expensive equipment? Do you have to, renovate the place, buy new stuff? How easy is this to really implement for most chiropractors in their practices?
Okay, I have one word for you, Jason. It's called the neuroscan. And the neuroscan, because I know, docs, I totally get it. You're like, I'm so busy as it is.
Yeah.
But recognize that it doesn't have to take an extra hour with each patient to implement postural neurology. That's exactly, and we recognize that a lot of people see that as being a limited belief. And so what we've done is, again, we took this complex information, we broke it down in bite-sized pieces in the sense that we are going to introduce to you in the free training exactly how to perform the neuroscan. The neuroscan allows you to evaluate brain function in relation to the posture system in 3 minutes or less.
Wow.
So literally, as your patient comes in, you're doing an assessment anyway. Add these simple things with the neuroscan to your current assessment, and you're going to understand brain function more than you've ever understood before. 3 minutes or less, that's my promise to you. And once you do it multiple times, it's going to be 2 minutes. But the first time you do it, it might take you 3. So the neuroscan in terms of time is going to be so valuable to add to your current protocols. And in addition to that, you don't need to buy a bunch of new equipment. Again, that's another limiting belief that I think a lot of people have with neurology is they have that picture of, like a big brain scan or, the gyro stim and things like that, which are cool. Don't get me wrong. They're amazing. They have a lot of benefits.
Yeah.
They're very cool. But you don't have to have that in your practice. You can have the patient seated on a chair and you can spin them in a chair. You can also do one leg balance, which requires absolutely no equipment, and the patient can do it at home. Simple eye exercises that are dramatically going to change your patient's head postural design. We're talking a lot about forward head posture today. You can implement these eye exercises, no equipment needed. Again, they can do them at home. So you don't have to take up a bunch of your extra time, and you don't have to completely renovate your clinic. You can just add this stuff in addition to what you're already doing, and you're going to get phenomenal results.
Give us a sense for how a chiropractor can expect to sort of change. All right, they go from being a chiropractor to an expert in a particular category. Would you sort of describe more about just what the psychology is that's different and the benefits that you've seen people who are doing this have and experience?
Yeah, well, just the research alone demonstrates that from 1999 up to 2009, that referrals to a specialist doubled. So when you have an expertise and when you can position yourself as an expert within your community, and let's recognize what an opportunity we have with social media, with Amplified supporting us what we do. You can absolutely position yourself within your community as an expert. And when you do, you become the go-to person. So you're no longer, the doctor that has all kinds of openings and people go, when they're desperate. You're the go-to person. And you have a waiting list practice, and people will pay expert level fees because you're the go-to authority within your community. So that's the mindset shift, going from, a desperate doctor who needs patients to the patients need you. And when you make that shift in your practice, and again, you have to do it the right way. You can't just suddenly pretend to be an expert. You got to raise your knowledge to expert level, of course. But once you do, and once you can provide those results to your patients, it's game over. You're the authority, you're the expert, and your practice is going to grow. And please utilize social media to your benefit. We have Jason putting together such great information through Amplified. All you got to do is click the button to share it. You don't even need to spend the time creating it. So it's a phenomenal opportunity that I want everybody to take advantage of course.
I appreciate that. I don't know what else to say. I mean, I love what you're doing. I love that it's both, communication oriented again. Not to sound repetitive, but just to drill the point down. People don't go, I don't believe in that. Posture appeals both. I should say there's several things. It appeals to your vanity, which is certainly an issue, right? It appeals to the musculoskeletal side of things. It appeals to the brain neurology side of things. It's just one of those, I think, dream come true topics that I think is the intersection of where we really have the opportunity to allow chiropractic to become, extremely wide used worldwide. I mean, this digital device is everywhere. In fact, there's some countries that use them even more than America. So I'm in love with it. I love the idea. I love the concept. I think the idea of actually sort of having a certification behind it and not just sort of, just throwing the words around, but having the exercises, the knowledge, the skill set, everything I think they're going to learn in the training, the free training in the very beginning anyway, is nothing short of brilliant. I don't mean to sound overly enthusiastic, but you've got to be nuts not to go watch this simple free training and then learn to decide how far you want to take it. But it's just one of those investments I think that makes all the time in the world, and it's I'm just proud, in fact, to sort of align with you guys. We, from a communication standpoint, think this is one of the best ideas out there that's possible. So.
I appreciate that. And I just want to piggyback on a couple of things that you're saying about communication specifically. Is that research consumer behaviors tell us that patients seek healthcare for one of three reasons. They want to look better, move better, or feel better. As you mentioned, posture is the only specialty that provides simultaneously each of these three values that your patients want and need. In addition to that, the research also shows that 85% of patients don't understand their doctors. 85%. And that's not just chiropractors, that's all healthcare professionals worldwide. So when you speak to patients in terms that they understand, posture is a word that's been in their vocabulary since they were born. When you speak to them in words that they understand, you put yourself automatically in that 15% where people understand what you're talking about. Another research statistic shows that 50% of patients don't know what to do next when they leave your office. Make it easy for them to say yes to care. Make it easy for them to know the next steps by utilizing posture and postural neurology within your clinic to set them up for success as a patient. They want what you're providing. They want to look better, move better, feel better. So you can give it to them, and the best part is they can understand and verbalize what you're saying, making not only it easy for them to say yes, but then it makes referral ammunition. So just like that, your patients is going to be your practice is going to be growing. And the best part is it's results focused, and it makes sense to everybody. From the general population to the medical doctors, everybody gets posture. Yeah. It just makes a lot of sense.
I want to clarify, because I can hear some chiropractors' minds going right now. Please elaborate a little bit in more detail. For those that are thinking, does this mean I'm no longer a chiropractor, or that they don't think they're getting chiropractic care? Or how do those, let's just call them principled or traditional chiropractors, reconcile that this isn't changing your identity, or this isn't a new profession necessarily, that it's just simply another way of communicating, an alternative communication technique? Is that the case? I mean, for those that are like, no, but I'm a chiropractor that does chiropractic, is this a contradiction for them?
Yeah, thank you so much for asking that question, because let's be straight on this. And absolutely, your chiropractic adjustment is your how. It's how you deliver the goods. So your communication is communicating your why, which is getting the patient well, and you're meeting the patient's values through their system of beliefs. But the chiropractic adjustment is absolutely what's making the life-changing results. So implementing additional things to help them hold their adjustments longer through postural neurology is going to benefit you, because this is going to avoid the patient that's like, oh, doc, I felt so great after that one adjustment, and then 24 hours later it came back. Or worse, they don't even come back into your office because they didn't want to tell you that it stopped hurt, it started hurting again 24 hours later. So we're avoiding those patients. We want them in your office. We want them to hear the chiropractic message, but maybe they need to hear it through posture first to understand what it is that we're saying, and then we can implement some postural neurology strategies to get them well in support of the adjustment. And like I said, we've studied a lot of different stimulations to the posture system through neurology, and it's clear the most powerful stimulus to the system is a chiropractic adjustment. So own that, love it, and just be so proud of the fact that that's what we offer. But recognize, too, really effective communication strategies that we can all utilize via social media, especially, of how we can communicate to our patients. Thanks for asking that question.
Yeah, one of the things, and I don't want to take everybody too long, go watch the free training and so on, but I just want to sort of close with one of the things I love so much about this is, many of us have been trying to figure out how do we communicate to the public that this is about more than your symptoms, that, how do you get more kids to start the process of getting checked and adjusted when necessary. And listen, my kids don't walk around with headaches or neck pain or back pain. They're indestructible at this point for the most part. But if you say to me, are your kids on mobile devices on a basis? I go, of course. I roll my eyes. We all are. And if I can even get as a parent into the consciousness of how important it is to offset the damage without any symptoms whatsoever, it's absolutely the perfect way, I think, to exponentially grow your practice, especially what I think of as, my brand, or a more wellness-oriented practice. That's not just, come in when it hurts, see you when it hurts again, but those that really want to build a base of people that want to be proactive. Again, you can't pay me enough to say what I'm saying. I just believe and know.
I know, I appreciate that.
This is the conversation we need to have with the community, with our public, and so on. So let me just give a couple closing thoughts, and I'm going to give you the last words. For those that don't know how Amplified works, we're a free professional service. I invest literally hundreds of thousands of dollars out of my own pocket because I believe in you. I believe in this profession, and I want you to have no excuse. I want this profession to have zero excuse as to why we can't get our message out to the masses. Now, one of the ways we offset some of the hundreds of thousands of dollars I've personally invested, and we do have supporters like Life University Standard Process and others, but one of the ways we actually subsidize some of the costs is by offering programs such as this. So I'm going to personally simply say, if you're watching this video, you may see this training from a variety of other people, but please, if you appreciate Amplified, if you appreciate what we're doing, please, click through our links, go through the training, through, what we're providing. We work hard to be able to make this a free service for everybody, and your support's appreciated. With that, Krista, please, final words. What do we need to do to get everybody to at least watch the free training? If not, just get really enthusiastic and excited to be part of, I think of it, one of the most important movements our profession is going to see in our generation.
Well, before I give my final words, I have to give you a thank you, because you have invested your time, your energy, your skills, and of course your finances as well into creating Amplified. And Amplified is a brilliant platform. I mean, truly, we're busy, docs. We don't have time to be creating all of this social media. But here's the deal. If we're not sharing on social media, we are missing out on the most important marketing strategy that there is. And it's so important. And as a profession, the more that we can be putting out regarding chiropractic care and looking up and technique and all of these things is just educating the population at a global level. So that's brilliant. And thank you for that. Thank you so much for that platform. And in addition to that, thank you for your support for the Postural Neurology program as well. So we've put together a free training series. This is a 4-part training series. And just to give you guys kind of a glimpse of what you're going to learn is this. In video number 1, we're going to be talking more about digital dementia. In addition to that, we're going to give you guys some patient education handouts that you guys can just print off or email directly to your patients. Then in video number 2, we're going to go through eye, spine, and vestibular. I-spine vestibular. That's the model of correction. So spine is going to be your chiropractic adjustment. And then doing some eye drills and some vestibular training that you can implement with that for your patients to do at-home rehabilitation. And then video number 3, I already told you guys about the neuroscan. You're going to learn exactly how to do it. We hold nothing back. I want you to walk away from videos 2 and 3 going, I already have things to implement. And then, of course, in video 4, we're going to wrap it up and we're going to answer all the questions that you have. So I would love it if you guys would check it out. Let us know how it goes. Let us know if you have any questions. And we look forward to seeing you in the free training. And thanks again, Jason, for this opportunity to connect with everybody who's involved with Amplified. Guys, I can't say enough how much I appreciate Jason and the whole Amplified team.
Thank you.
Thanks.
Thank you. The feeling's mutual. Please say hi to Mark for us wherever you're traveling in the world. I think I'll be seeing you at an upcoming event in the next few weeks.
Yes, exactly.
Everyone, thanks for watching. I appreciate it. I hope you find tremendous value here. Please watch the training, and in fact, please share our links with your colleagues, with other people you know that need to be a part of this. These are just some of the few opportunities we have to subsidize what we do. It's a great idea. It's one of those win-wins. It's why I get excited and keep on going. I don't do this often, but when I do, I mean it. So, Krista, thanks for joining us, and thank all of you for watching. Please go check out the free training, and please share it with everybody you know. Have a great day.
Thanks so much.